When most people think about hyperemesis in pregnancy, they think about morning sickness, a bit of nausea, perhaps some vomiting in the morning, something unpleasant but manageable, and usually something people say will pass with time. But every so often I see a situation that doesn't fit that description at all. A pregnant woman who has done everything right, she's eating carefully, she's trying to rest, she's trying all sorts of natural methods, trying ginger tea, trying small meals, just trying to push through. And yet she's vomiting 10 to 15 times a day. She cannot keep any water down. She's losing a lot of weight, exhausted all day, and she's told by the people around her that this is just normal pregnancy sickness. Even sometimes the doctors don't help, and that she should just tolerate the symptoms. And for her, this is possibly the worst thing you could say, because here's what is actually happening. HG, which is short for hyperemesis gravidarum, is not ordinary morning sickness. It is a severe biological response to pregnancy hormones that overwhelms the brain's nausea centers and disrupts fluid balance within the body. Hormonal signaling between the placenta and the brain is the upstream control center where pregnancy either stays physiologically manageable or shifts into severe nausea and vomiting, which can be devastating to endure. Assalamu alaikum, my name is Dr. Azad. I'm a medical doctor and a pharmacist based here in the UK. I have been working with patients for nearly 15 years, and one pattern you see repeatedly in the accident emergency is how often serious conditions are dismissed early. Now, this is not out of cruelty, but I'd say it's more out of misunderstanding. Hyperemesis gravidarum is one of those conditions, so let's slow this down. Most pregnancies involve some nausea. Hormones rise quickly in early pregnancy, especially the human chorionic gonadotropin, which is often called HCG. And with this, estrogen rises as well. The brain becomes more sensitive to smells. The stomach empties a lot slower. All of that can cause mild nausea. Now that is what we call morning sickness. But HG sits at a very different end of the spectrum. The nausea becomes constant. The vomiting becomes very frequent. Hydration becomes very difficult. Food becomes almost impossible to tolerate. And when that continues day after day, the body begins to struggle and decline. At this point, the electrolytes shift, energy levels will collapse, and weight drops. That's the shift. And that's where people often become confused, because the symptoms may look similar on the surface, but the severity is completely different. This is not someone who feels a little sick in the morning. This is someone whose body cannot maintain normal hydration or nutrition. And that is a medical condition. Now, at this point, let's zoom in, because recent research has been exploring something very interesting, a hormone called GDF15. Now, this hormone is produced by the placenta. It interacts with the nausea center in the brain. Some women appear to have heightened sensitivity to this signal, meaning the brain receives a very strong nausea message again and again throughout the day. That helps explain why some pregnancies involve mild nausea, while others develop severe hyperemesis. This is not about weakness, and it is not about mental strength. It's just pure biology, and that's what matters, because the stigma around hyperemesis can be extremely damaging. I see in many communities, severe pregnancy sickness is sometimes dismissed. Women are told to tolerate it, to be patient, to sometimes stop complaining, but hyperemesis gravidarum is recognized medically across the world, and when severe, it requires proper treatment. Now let's talk about what it actually looks like in real life. One of the early warning signs is vomiting multiple times per day. Another is struggling to keep fluids down. The patient might notice very dark urine, or feel dizzy, or experience rapid weight loss. And here, extreme fatigue is very common. Sometimes women describe feeling like they have constant motion sickness that never stops. It's there 24 hours a day. And that's when it becomes important to involve a doctor, because untreated dehydration can become dangerous for the mother and for the pregnancy. I don't want to scare you, but it can be fatal, and it can lead to further complications down the line. Now, I want to emphasize something here. This isn't laziness. This isn't a moral failure, and this isn't someone being dramatic. This is a physiological condition that some women suffer from. And when families understand that difference, support will improve dramatically. Now here's a part most people miss. The one mistake I have seen people making is that with hyperemesis, they can assume that it will always pass on its own. Sometimes it does, depending on which trimester, but sometimes it continues throughout the whole pregnancy. And when dehydration and weight loss begin, waiting too long can make your recovery much harder. Now, early support is far more helpful. Now, let's talk about what actually helps here. First, there are gentle approaches that can help. This is after speaking to a lot of women suffering from HG. You could try small, frequent meals, dry foods like crackers. Ginger apparently helps. Vitamin B6, and making sure you rest, and going out your way to avoid strong smells that can set off the nausea. For some women, these few simple tips are not enough, but for others, they can help. When it becomes severe, that is when medical treatment becomes extremely important. If you come to the A&E, medications such as anti-nausea drugs are commonly prescribed by us. Fluids may be given through a drip if dehydration becomes severe, and sometimes short hospital support is needed for you to get out of that phase. That doesn't mean failure. That is just the appropriate medical care that is required. Now, let's zoom out of all this. Pregnancy today also occurs within a modern environment that is often physiologically stressful. You can have irregular sleep, pressures from work, artificial light late at night, constant stimulation. Now, these things influence hormonal signaling and stress response, not as a single cause, but as a background pressure on the system. And pregnancy is already one of those most biologically demanding periods of a woman's life. So this is where I keep saying support matters. Practical support, emotional support, understanding. Sometimes the most helpful thing a family around you can do is recognize that this illness is real and to give the woman space to rest. Help with food preparation, help with childcare, help with daily tasks, because recovery often requires energy the body just simply does not have. Now, just to end, there are also important red flags to be aware of. Now, if a pregnant woman cannot keep fluid down for more than 24 hours, if vomiting becomes constant with no rest, if you're feeling dizzy when standing, or if you notice that your urine becomes very dark. Another one to look out for is if you have rapid weight loss that becomes noticeable. That is the point where medical advice is urgent, and these situations deserve proper care. Hyperemesis gravidarum is not a normal morning sickness. It is a recognized medical condition, and when communities understand that difference, the stigma will begin to fade. Pregnancy should never require silent suffering. You need support, you need understanding and timely medical care, which will make an enormous difference. Thank you for watching. I hope that helped. I wish you all the best for your pregnancy, and inshallah I will see you in the next video. Take care. Assalamu alaikum.